I'd like to ask you both permission to use this video for educational purpose and on the internet.
Sure.
Do I have your permission? Okay. Now, tell me now about your symptoms before the surgery.
My sciatic nerve or my left leg was in excruciating pain when I tried to walk. And I couldn't walk into the store without turning around and walking right back out to the car.
How long was it going on?
About a year.
1 year. Now, many patients in a situation like that, the problem is the spine that we can fix. And unfortunately, some patients, they think surgery is like a switch of a button that, just turn off the pain. It is never like that. And I want you to describe, first of all, we did the surgery just 3 months ago, correct?
Yes.
And it wasn't at one level, it was a 2-level fusion that we did. And I'm just going to actually turn around and here show this, that we got a 2-level fusion. This is considered a big surgery. How long did you stay here in this hospital?
Just overnight.
Just over the night. Can you describe to me now what after the surgery, how the symptoms were? And obviously the pain was before the surgery on higher level. But how did it develop? How did the pain improve after the surgery?
It took about a week and it just gradually subsided.
Yeah, you want to chip in?
Yeah, as far as healing was concerned, it was from surgery to now, it's been a very slow but a very consistent.
I like that slow and consistent because that is exactly what I expect.
Yeah, very slow but very consistent. This pain goes away, that pain goes away. He can stand a little longer. I don't feel like he's arrived, but we're getting there. We are getting there, and there's been no backtrack.
Yeah.
And
sometimes as well, the patients are telling me that from the surgery it gets better, it gets worse, it gets better, it gets worse. And when we look into that, people get better, they want to do more. The body tells them too much.
Yeah.
right.
There's a little backtrack, and then that's sort of all depending on how your body heals. And that is as well normal. So meaning up and down with the pain and so on. But if you have a good common sense and you don't do anything excessive, it's a slow, steady improvement. But the sharp pain in the leg is gone.
Yes, definitely.
Yeah, and walking is getting better.
Yes.
We looked at the films. The bone in the front of the bone where the vertebral bodies are, it's growing. In the back, it's still working on it, so it's not completely done. So there is a reason they call you patient.
Yes.
Because it's hard to be patient, okay?
Yes.
But this is actually exactly what I expect, and you are just a typical. You are not my fastest, healing person. You are not my slowest healing person. You are just exactly how I expect it to be. So, and that is, I think, would be helpful for my other patient to understand. You told me some activity though causing some pain. Do you want to elaborate on that a little?
When I brush my teeth.
And how do you do that? So what does that activity position of your body entails that aggravate the pain?
I kind of get at a 45-degree angle there while I brush my teeth over the sink, and then when I go to straighten up, that's when it hits me right then.
And that is, part of that is that BLT, bending, twisting, lifting, that we tell you it's going to be painful for a while. Part of that as well we examined you is where the spine and the pelvis are joining sacroiliac joint. We know, especially after the surgery, often, sometimes temporarily, as a matter of fact, most of the time temporarily, where the spine and the pelvis are joining, that joint gets stressed and cause additional symptoms. And I think this pain that you're describing possibly is even more related to your sacroiliac joint. We don't have to do anything about that. Your pain is still below 5, but these are exactly the reason we tell people don't bend, twist, and lift, because those are signs that the spine is or area getting more stressed out. So listen to your pain.
Yeah.
Okay? Well, this has been very helpful for me and for my other patients. Any other comment or any other thing you want to,
The brace, how much longer should I be wearing the brace?
The brace is usually, we tell 4 weeks when you walk, 4 months when you are in a vehicle. That is to give you support, and then slowly you wean it off. Okay?
Okay.
Excellent. Well, thank you so much for the interview. Okay, I appreciate that.